giving you a detailed policy presentation on all the aspects of the healthcare education bill, but I thought I'd use my time. I want to give you 4 bill numbers that I think it's very important that we advocate for this session. But I wanted to just give you some off-the-cuff thoughts about the League and what you do and how our democracy works here in Oregon and in America. As you know, I have a long history with the League of Women Voters. My mom was, as you know, an activist down in Eugene and a state president about the time that I ran for office, and she had a very profound impact on my career, my life, and my beliefs. And one of the things that really struck me about the League of Women Voters from the time I was very young was the belief that that citizenship and democracy doesn't end at the ballot box. It actually begins at the ballot box. And I think far too many people think that if you just change the governor or the president or the members of Congress, all the problems go away, and you really don't have any responsibility beyond who you vote for, and that your engagement is on the campaign level, not what happens after that. And I think that's one of the problems that we face in our country today, the fact that this system only works to the extent that citizens own it and get engaged in it. Now I want to give you an analogy from a guy named Ron Heifetz, who teaches at the Kennedy School back at Harvard. I think he's a physician, I think he was a surgeon. But he talks about problems, and when I say doctor, I want you to think government, and when I say patient, I want you to think citizens. So this is a medical analogy, but I think it says everything about sort of where we are today and where we need to go. So a type 1 problem would be like bacterial pneumonia, where you go to the doctor writes you a prescription for an antibiotic, and you get better. So the responsibility to solve that problem rests just with the doctor. A type 2 problem would be like cardiovascular disease, where you can go to the doctor and they can give you some medicine to help your heart. They can give you something to lower your cholesterol, but if you don't change the way you live, if you don't stop smoking, if you don't change your diet, if you don't exercise, you're not going to get better. So a type 2 problem, to solve it, there's a shared responsibility between the doctor and the patient. And a type 3 problem would be like terminal cancer, where the challenge basically is for the doctor and the patient to figure out how to deal with a set of circumstances they can't change. So there's something you have to deal with. How do you go beyond that? The problem in America today is we've got a type 1 governance system trying to solve type 2 and type 3 problems. You can't pass a law to reduce poverty. You can't pass a law to reduce child abuse or deal with at-risk kids. It requires a huge community effort. So let me give you a little contrast about where we were 44 years ago and where we are today, and what's changed, what hasn't changed, and what should change. So I got my political awakening in the spring of 1968 with the assassinations of Martin Luther King and Robert Kennedy. And that was a period of intense citizen involvement, whether it was registering black voters in the South, whether it was going in and sitting in segregated restaurants so you could get arrested and go to jail because you wanted to highlight a law that was discriminatory, or whether it was Bobby Kennedy's last campaign, which was all about poverty. It was all about the disenfranchised in America. It was about giving a voice to the voiceless. It was about engaging citizens in something larger than themselves. Well, today, all those problems that we were trying to solve in 1968 are still with us. Oregon has 21 counties that still have over a double-digit unemployment rate. 1 out of every 4 children in this state is hungry. Half of all African-American children in Oregon live in poverty. 18,000 kids every year come to school unable to learn, with a huge achievement gap because of risk factors that they experienced when they were very young. We're only graduating 67% of our kids from high school. So a lot of those problems haven't changed much, have they, since 1968. But the fact is, there is no quick fix to those problems, but there is a fix. And the fix is based on, I think, the premise of the League of Women Voters, that without citizen engagement and ownership in these problems, we're not going to solve the problems. But what you have to solve those problems is a clear direction, a common vision, a destination where you want to go. They all need to believe in and be invested in. When John Kennedy made that famous speech in 1962 that we were going to put a man on the moon before the end of the decade, he had just received a report from the National Science Academy that said it's impossible to go to the moon. We didn't have the technology, we didn't have the wherewithal to do it. So what he gave us was not a roadmap, but a destination. And that destination was so inspirational that it allowed us to mobilize the resources of this country and actually make it happen even before the end of the decade. I just met with the president of Freightliner, and they have set a goal for themselves that they're going to increase fuel efficiency 5% every 3 years. And he acknowledges we don't know how to do that yet, but he's convinced that if we set that goal, we can get there. Well, here's the goal we set for Oregon, that by 2025, we will have 100% high school graduation. That every child in Oregon will graduate from high school. Now, the kids who enter kindergarten next fall, they are the class of 2025. 13 years to get that done. And that 40% of those kids, when they get out of high school, will get at least 2 years of post-secondary education training, and another 40% will get at least a baccalaureate degree or higher. We've also committed ourselves to driving per capita income in this state back up above the national average in every region of Oregon, urban and rural, and to erase the income disparities that exist within our communities of color. Now that's an aspirational goal, but it's also a goal that's possible, and there's two things we have to do to get there. The first has to do with public education. If, as I believe, the promise of opportunity is what lies at the heart of the American dream, the promise of upward mobility, the belief that if you work hard, you can create a better future for your kids, then education, public education, is the vehicle through which that opportunity is most directly fulfilled in this century. And that's important because the generation right now is the first generation in America that is likely to be less well-educated and less well-off than their parents. That wasn't even true in 1968. So we've got a lot of work to do. So education is the first piece. And kids who actually graduate from high school are much less likely to end up in the criminal justice system, to end up with social support services. So if we do this right, we're going to reduce the cost in the back end and be able to reinvest that in education. The other area is healthcare, which is one of the fastest growing costs in this country. 17% of the gross domestic product producing health outcomes, not much better than Cuba's. And the opportunity cost of spending all that money on healthcare means that's less and less money spent on education. So we have to drive down the cost of healthcare to make people healthier, but also to free those resources up to invest in kids and in education. Last session, we took two important steps along that way. We passed a bill, Senate Bill 909, that created an early learning council that has developed a plan that will ensure that every child in Oregon is ready to learn when they get to kindergarten, ready to read when they get to first grade, and reading at level when they leave the third grade, which is a powerful indicator of their trajectory to success in college and career. And it also created the Oregon Education Investment Board that's going to create a transparent pre-K through post-secondary education, seamless education system that's focused not just on funding schools and institutions based on enrollment, but funding students based on performance, outcomes, and success. The second one was a bill that, starting with the 600,000 people in the Oregon Health Plan, will try to drive the rate of inflation in the Medicaid program down a full 2% by changing the organization and the incentives in the system from after-the-fact care in the ER and in the hospital to wellness and prevention and management of chronic conditions at home and in the community, potentially saving us $3 billion over the next 5 years, which in turn can be reinvested on the front end to kids and education. So what we need you to do is to support those bills. We need permission from the legislature in the next 3 weeks to go forward on those bills. I'm going to give you the numbers, just so you can go read them if you want. I know that's what you guys do. My mother used to spend hours and hours reading everything I think that came across the desk up here. So the big healthcare transformation bill is Senate Bill 1580. And there's a House bill that has the same language in it, which is House Bill 4153. Those are both down in Ways and Means, and one of those bills will be the vehicle. That'll be the decision will be made tomorrow night, which vehicle to use, and hopefully that'll move out. The Senate Bill 1581 is the Oregon Education Investment Board bill that allows us to build out that transparent 0 through 20 system. Then the other one is House Bill 4165, which is the Early Learning Council bill. So I'm hoping that you will help us with those bills. I just want to close by saying that anytime you change, you make changes, people get nervous. Everyone wants to change our system of early childhood learning as long as they don't have to change their program when the funding stream continues to go to their program, not to someone else's. At the end of the day, we need to step back and stop clinging to programs and figure out how to solve problems for kids. Every year we delay, another 18,000 kids are put on the path of failure because of our inaction. So the adults in this system need to stop focusing on their programs and begin to ask themselves, how can we work together to actually get outcomes for our children? Yeah, we don't know everything to know. John Kennedy didn't know how to go to the moon in 1962, but we figured it out. But they had a destination. And every single year, we need to take another step towards that destination, towards those objectives that I described for you for Oregon. Teddy Roosevelt once said that in a time of decision, the best thing you can do is the right thing. The worst thing you can do is nothing. We're not going to do nothing here in Oregon, and with your help, we will achieve that vision, and we will look back in 2025 to this day here in 2012 and say it began right here, right now in Oregon. Thank you very much.